Okay, so we're going to spend a little bit of time talking about enrollment and eligibility. So we talked in the beginning of the session how we interviewed a lot of your colleagues to try to understand what were the key components, what were some of the lessons learned, where were some of the barriers when those folks began the Medicaid process. And surprisingly enough, eligibility and enrollment bubbled to the top of the list, whether it was a small provider or a large provider. It kept bubbling up to the top. So we wanted to spend a few minutes talking about that with you so you understand the process of how a person becomes eligible for Medicaid, which you may already understand, but then what's the process for enrolling in an actual MCO and who has the roles and responsibilities there and how that works. And then also what your role as a provider of Medicaid MCO members, what your role is in that as well. Sound good? All right, so there's two separate and distinct processes with the eligibility and enrollment of the Health Choice Illinois Medicaid members. And the MCO does not have a role in either of these processes. So that is a misconception. Many folks believe that the MCOs have something to do with enrollment or assignment, and it's completely done outside of the actual MCO entities. So the first process is becoming Medicaid eligible, which many of you in the room are familiar with. That is done with HFS and DHS, whether they have the income requirements, the medical conditions, or what have you, following that criteria, eligibility is determined at the HFS and DHS level. From there, HFS hires like an independent broker. It's called, they call it the ICES. You will see that abbreviation. That's the client enrollment broker. So again, it's separate from the MCOs and separate from HFS because HFS is contracted with this agency to do member assignment. So then from that point, and I'm going to walk you through the actual steps that the member goes through, the client enrollment broker, so once they know, hey, Angela's eligible for Medicaid, and they're going to send the member a letter from the broker. So they're going to say, we know you're eligible, it's time for you to pick an MCO and a PCP to facilitate your care moving forward. If they don't choose one, if they don't choose a PCP and they don't choose an MCO, then the client enrollment broker will assign one for them. So again, there's different, HFS is involved, DHS is involved, and then now you have this client enrollment broker. So these are the folks that are facilitating enrollment into the health plans. So here I just wanted to walk you through, there's two tracks that a member can fall in or one of your patients can fall in. They can either respond to the letter or they cannot respond to the letter. And it's different things happen depending on what their actual response is. So they're all gonna get the letter. Any member who becomes eligible for Medicaid will get the letter. Hey, you're eligible, choose a PCP, choose an MCO. They have 60 days to choose. If they do not respond in the 60 days, the client enrollment broker will auto-assign them, okay? So they're auto-assigned. So let's just walk through this one. So the member does respond. They contact the enrollment broker. They can do this online. So if you have members that are newly eligible for Medicaid, it's so much easier if they go online. It walks them step by step on choosing the MCO, choosing their provider. Once they choose, they have another switch period. So they have 60 days to choose, then they have 90 days to switch. So this is a really critical time for the MCOs. Some of the MCO clients we work with, we tell them, like, this is your chance. Like, you're already providing services to them, so why not wow them in this 90 days so that they don't switch? Otherwise, as you can imagine from a provider perspective and a member perspective, it gets a little hairy if they do change because you've only had them for 90 days as an MCO. And if they come to you and you think that they still have the original MCO, then you have claims issues and that type of thing, which we'll talk through that in a minute. So they have a 90-day switch period. Once that 90 days is up, they're locked in for 1 year. They cannot switch MCOs for 1 year unless there's some significant circumstance which would trigger an opportunity for them to change. But 99.9% of the time, their members are locked in for 1 year to the MCO. Now, if they don't respond to the letter, again, they're gonna get the letter, they have 60 days. If they don't respond in the 60 days, the broker will auto-assign. They're gonna choose a PCP for the member and they're gonna choose an MCO for the member. And that is done through a state algorithm. So HFS uses the algorithm a little bit like a stick with the MCOs. So if they get in trouble or they have a sanction or they get something like that, you may have seen letters come out where this MCO can no longer receive auto assignment, right? So they come out of the algorithm. The original algorithm is based on lots of different factors like their PMPM, their quality, their MLR. So there's lots of different things that go into determining the hierarchy of who gets members first and then what happens. So I won't get into all that because it gets complicated, and HFS is actually changing it is the way I understand it. But it's a state algorithm, so it's fair. Then the member will get auto-assigned. So they're going to get a letter and say, you didn't respond initially, so we went ahead and did it for you. So here's your MCO, here's your provider. They have 90 days to switch again. So in the meantime, they're getting information from the MCO that say Blue Cross was the MCO they were assigned to. So Blue Cross is sending them enrollment packets, sending them ID cards, all in that 90-day period, but they can essentially switch. So that's why it's so important as a provider to stay on top of what your members are doing as far as which MCO they're actually assigned to. So I know that's like very confusing, but I'm gonna try to help you a little bit more. So here is just for, as it is, well, this was as of October. It's been pretty steady state since then. But starting any day now, these will all be changing names and numbers. But essentially, there's a little over 2 million people in the Health Choice Illinois program, and they're assigned to these various MCOs. Now remember, county care and next level are only in Cook County. The other 4 are statewide MCOs. But this just gives you a sense of where the membership is here in Illinois, which I think is important. All right. So I talked about the members having the opportunity to switch on an annual basis. So this is also very confusing for providers, MCOs, and members. It's taken me a very long time to get my head around this. Lindsay and I are rallying to get the word redetermination removed from any vocabulary used with Medicaid members. Everything that you communicate with a Medicaid member has to be at the 6th grade level. The word redetermination doesn't even make sense to like you and me. So I don't know why they call it redetermination, and they post it all over the place. But redetermination, I thought when I started, I thought, what the world is that? It's renewal. So we, all of the clients that we work with, we ask them to switch the word redetermination. Do you know what renewal means? Yeah. Redetermination, not so much. And it gets confusing. So this, if you see the word Medicaid redetermination, it's their Medicaid renewal, meaning are they still eligible for Medicaid? They have to do that, it varies, it depends on what program they're in, but 6 months to every 6 months, they absolutely have to do it every year. So majority of your members will go through redetermination or a Medicaid renewal every year. That means they will receive paperwork from DHS that they must fill out. If they do not fill it out, they lose Medicaid coverage. So what we advocate for from a provider perspective is this is a great opportunity for you to help with that member engagement. Because you obviously, as their provider, want them to keep their benefits. If they lose their benefits, that creates a whole host of problems for you as their provider as well. So we'll talk about some ideas on actually collaborating and partnering with the MCOs on this whole redetermination and renewal process. Because again, if they do not fill it out, they lose their Medicaid coverage. The other thing that happens to a member at a different time, in most of the cases, these are 2 different processes at 2 different times during the year. So they've got to figure out if they're still eligible for Medicaid, and then every member gets an open enrollment period, which is really your health plan renewal. So you can kind of think of that as your own coverage. You annually get to choose your health plan, right? If you want to stay with the plan you're in or if you want to move on. So that happens every year. Again, that communication comes from the HFS and the client enrollment broker saying, this is your chance. You've had Blue Cross for 1 year. If you'd like to stay with Blue Cross, you do nothing. If you want to change, you must do it within this time frame. If you do not do it within this time frame, you stay with Blue Cross. You get a one chance only, and then you're locked in again for that 1 year. So in Illinois, our members, our clients and our patients, these dates vary for every single member. So it's one of the opportunities is to understand from your patient's perspective what their renewal dates and redetermination dates are and what their open enrollment dates are. So you can help them navigate that process. Many of the MCOs have resources that they will allocate to helping members do redetermination. Many of them do postcards, letters. They also, what I did when I was on the provider side is ask for a list, because every MCO has a list of each member's redetermination renewal date. And that way then as they came into the office, your process could be, I see you're up for renewal for Medicaid in October. Any assistance we can provide you? Do you have the website? What have you? So there is a really great opportunity for that partnership and that engagement at the patient level here. So remember, there's 2 dates for every member at 2 different times: Medicaid renewal and open enrollment. I know, sillily confusing. Yep.
You said something with every 6 months.
Well, it depends on, go ahead.
Yeah, so,
turn your mic on.
If you are on Medicaid but also receive SNAP benefits, you have to do it every 6 months. If you're just on Medicaid, you're not getting the food stamps, you just do it once every 2 months. So if you have SNAP, you have to do redetermination.
Every 6 months, yes.
Yeah.
And there may be others. Those are just the ones most common to us.
Yeah.
I don't know all the rules, but I know that one's the most common one. But they have to do it, otherwise they lose their coverage. Now, HFS tries to give them like a 90-day window to try to reassign them back to the same provider and the same MCO. It doesn't work that efficiently, and sometimes it just causes a huge gap in care, right? So this is where we think that there's really a provider role at working with the MCOs to understand when your patients are up for renewal from Medicaid and when their open enrollment dates are. Those would just be really helpful tools just to help your patients continue to have the coverage that's going to give them the best care. Because what happens is if there is a gap in coverage and you submit that claim to the MCO, the claim will get denied. And the recourse for that is very difficult. Sometimes you'll have to resubmit to fee-for-service. Sometimes you'll have to find out if there was another MCO assigned. It just gets really complicated if we have that gap in care, gap in coverage, excuse me. So again, as we met with many of your colleagues, they pointed out that their biggest lesson learned was having an eligibility workflow, that they didn't realize how they thought this could just be weaved into their current process of check-in and so forth, and what they found was it's a bit more complicated than that, and that was where they really had the biggest hurdle right out of the gate, was not putting enough emphasis on the eligibility or the enrollment check-in process as patients came in. So many of all health plans have a card, but the card is not required. Like as a provider, you can't, HFS was very clear to us and actually wrote it in our deck. You cannot deny coverage for not having a card. You can't turn them away for not having a card because you have another option to check eligibility, which is the Medi system. Have you all heard of the Medi system? Yes, okay. So the first thing is if you can get them to bring in their card, that's the best. That's what you and I do when we go into a provider office. They take a copy of your card. That's a process that you may or may not want to institute, but it's helpful. Also, you can check the Medi system, which we'll talk about here in a minute. That's the HFS system where you can go in and see eligibility electronically through the state system. Lindsay and I are broken records with this document. So in some cases, if you're taking screenshots, taking copies of the card, those types of things will help you in your own records because there is sometimes fluctuation. And if Medi says that they're active with this health plan and you have a screenshot of it, then you have some recourse there to work with both HFS and the providers. And this is also monitoring claim denials for eligibility. That was also a lesson learned from some of your colleagues, that they weren't really monitoring that, but eligibility is the #1 claim denial, member eligibility from all MCOs across the board. So it's such a critical piece to the whole process. Yes, getting your claim form filled out is also critical, but right out as they walk in your doors, getting this piece right will really help you as you navigate the MCO billing process. So the Medi system, another hurdle is you want to make sure that you have signed up for the Medi system and that the right people have access. So some of our clients we work with, they said, yeah, we have Medi, but if you don't have if the right people don't have access to it, it's not going to help you on the front end. You really want this to be a prospective approach to enrollment and making sure those people right at the front desk. You may have to give, if you have multiple clinics at different sites. We found one, I think it was an FQ, they had a kind of a centralized system, a centralized enrollment system, but they had sites out in the field, right? So they didn't give those people access. Well, you're kind of too late if you're checking only at your central office, because you've now lost that connection with the member, the opportunity to engage them, ask more questions about who's your health plan and where and what and so forth. So really check understand your current process and understand what changes you may have to implement in order to really facilitate this more efficiently, and again, be more at that front end of the whole process. When you get this, these are real links. You can go in there, how you have to set up your Illinois digital ID, how you can designate a main, kind of like an administrative account, and then how you assign people to that account so that, again, they can have access to the Medi system and have that process to check. Because even if they send you a card, if a member presents a card, you can still go into Medi and see if that's maybe they didn't change their card, maybe it's an old card. You know, you may want to have that double check. Just being on both sides, I would recommend that. All right, so we talked about redetermination, or what we like to call renewal. We also talked about open enrollment, and then having that eligibility as a key component of your check-in process and facilitating that right out of the gate. Are there any questions about that? Really confusing? 2 dates for every member, 2 different dates. Working with the MCOs to find out those dates will really be helpful. I think some of them are actually in Medi too, but yes, it's much easier to get a list than it is to check each member, obviously, or each client in Medi. Yeah, sure. Let me let Carrie come over.
On the page with the sample cards,
yep,
there are some effective dates on the cards. Is that the enrollment effective date or the date that they are effective with the plan?
Well, it can be different. My experience is it's the effective date with the plan, not the effective date with Medicaid.
That makes sense.
Yeah. Some IT systems are more sophisticated than others, and I've seen them list both. I think, thought there was one of our clients that had both, but that is usually the effective date with the plan. Some plans, though, don't send out new cards each year if they're a concurrent member, so if they're a member of the previous year. So sometimes that gets confusing because the member will think they're supposed to get a new card, and if they didn't change MCOs, many of the health plans won't send a new card. So most likely that is with the plan.
Okay, thank you.
Yeah, good question.
To get the list of redetermination dates from the MCO, would you recommend, again, going through the provider or the network provider people? Okay.
Yeah, I would. That's a great opportunity for you to show collaboration and coordination. So yes, they get a report from the state every month that tells them over the next, I think it's out 3 months, who's coming up for renewal for Medicaid. Yeah, great question.
Can we go back to coding for a second?
Yeah.
So how are the MCOs prepared to account for trans clients? Your prostate exam
I'm working
question.
on that section.
We're working on that. It's so,
Yes.
Maybe Angela has more insight.
Yeah.
They are working on gender affirming surgery. There's still work being done on that very thing, because there are clearly, even if you're, how you identify gender-wise versus, you're still going to have certain medical services that could be provided, even if that's not the gender you identify with. So they're working on that right now to kind of comb through what that might look like and how we have to configure systems to make sure that that doesn't happen. But no answers yet, other than we will be coming out around gender-affirming surgery and some of the procedures and processes around that.
Any recommendations for providers to make that as smooth as possible in the meantime?
Well, the MCOs did have to make some changes early on to be able to accept different sexes for different traditional services. So those changes were made quite some time ago. Now this specific HFS is working through an actual authorization form and for different services that may have to be provided. In that form, we're actually having a call at the end of the month. So what our role with the billing manual is we try to bring people together to talk through their different processes and how they're gonna handle situations. So that call's at the end of this month. But if you look at that authorization form, I think there's a lot in that form that could be transferred to other types of forms, like the way that they position different questions, I think will be helpful for many of the documentations that the MCOs and HFS are using. The form looks really good, the authorization form, but at this point we don't have any clear direction on what you could do at this point. I think it's still definitely a work in progress, but I think there's stuff coming real soon. Our call this month is about how each MCO is going to handle the authorization process, the communication process. Many of them are putting together their own manuals that they'll have online to help providers navigate that. But again, it's new, so we'll still have to, we'll work with them as well and then see what comes of it. But it's a really good question.
Thank you.
Yeah. Oh, Jesse.
So our client population are people that have experienced homelessness, and so they ask for a lot of assistance with these processes, with the renewals and with signing up for the MCO. I remember this from a while ago that the state is very clear that so if we transition to providing services, Medicaid reimbursable services, and they still come to us for advice on which MCO should I enroll with or which one should I pick, we have to be very careful about not making sure there's a clear distinction between our providers giving any of that information versus right now we have housing case managers that help people with that.
So yes and no. First of all, providers are always encouraged to help with renewal, Medicaid renewal. No restrictions there. In terms of helping them through the open enrollment process, MCOs, it's verboten, right? No MCO can be involved in that process. Providers can be. Providers can say, maybe you have a really good provider-patient relationship, but you don't have a contract with Molina, and this person is saying, well, my friend's on Molina, and I think I'm going to switch to Molina. You have every right as a provider to say, you know what, that's your choice. I mean, always let them know they have a choice, because I think that's important. They should have some ownership in the process and some, authority in the process. But there's nothing wrong with telling them, you know what, it's your choice, but just so you know, we don't have a contract with Molina, so the services and the care that you're getting with us at Howard Brown, we're not going to be able to provide anymore. And many of the physicians are allowed to send out, now this is physicians, I'm not sure if it's extended to other providers, I don't think it's a regulatory reason, it's just that primary care providers tend to be the ones that see the patients the most. There's a template that the state sends out during open enrollment to physicians to say, hey, if you want to use this and talk to your patients about open enrollment and plan choice, here's the template of the letter, and you can fill in, these are the plans that we contract with, these ones we don't have a contract with. Right. We really like working with county care, or whatever the plan may be. Right. Is that helpful? Yeah. It's just the MCOs can absolutely not do anything related to plan choice.
But for renewal and redetermination, the state is open to anything.
Absolutely.
Like they want all the help they can get, and actually transitioned recently more of that responsibility onto the MCOs, because they were just struggling as an agency to really get folks to renewal appropriately, and they realized that gap in care really is a problem, not only from the from the member perspective, but as a provider perspective. If you have members coming in and out of coverage, it's really hard to coordinate their care, and I mean, not to mention you want to get paid. So I mean, that's really a struggle.
Yeah, and I think it's, the provider role is so critical, as Angela said, because the way the state does it is they send a letter to whatever address they
Right.
have on file. And if you work with the Medicaid population, you know those addresses and phone numbers are highly unreliable in many
Right.
cases. And so you're seeing these folks are coming in your doors.
Yeah.
And so, we don't have to worry about a letter getting to them. If you can see on the Medi system, hey, or you get a list from the MCO, hey, your renewal is coming up in 60 days, keep an eye out, or is this the right address for them to send the letter to? Or, can we sit down with
Yeah,
one of our
help you.
enrollment
Yeah.
counselors and get on the ABE website and walk you through that process? Because, it is, God bless the state, still very, very U.S. mail driven. And we know this population
It's
is not about the U.S. mail.
Right.
None of us are these days, frankly.
Right. I'm not even. Yeah. But it is in the best interest of the member to whatever you can do from a provider perspective. When they're face to face, you have that ability to engage them right there. And I think you'll be way more successful than the letter they get from the state telling them, right? You could
Yeah,
explain
and
the benefits.
frankly, even if they got a letter, it's scary. It looks like an
Yes.
official letter.
Yeah.
A lot of people are like, I don't want to open that because
It's
I
got
don't know what it's
forms
going
in
to tell
it,
me,
they gotta
right?
fill 'em out.
So, yeah. Sorry, you had a question.
I just had a quick question. Thank you. We had a claim where we billed Medicaid. They denied it, saying the client didn't have the coverage. So we went on to the Medi and noticed that the client had Blue Cross Blue Shield. Blue Cross Blue Shield said they didn't have it. So how do you handle something like that when nobody knows who the client is actually covered under?
You want to take that, or you?
Yeah,
probably dealt
I
with
mean,
that
I
more than
think
did.
again, the documentation is going to be important. HFS will, I don't know when this was, but there were some, for a period of time, there was a lot of discrepancies between the MCO lists and the HFS roles. So I think if you show it in Medi at Blue Cross, I mean, you need to work with Blue Cross on that particular situation. And then they really have the burden to work with the state if they aren't getting, because what they reconcile is their eligibility files with their payment files, so that might be why they're saying it's not our member. If they're not getting the capitation for that member, then in their mind, it's not their member, which is true. I mean, they didn't know they had the member, but but again, they'd have to uncover whether it was an issue with their eligibility files coming straight from HFS, or if there a problem with the Medi system. I mean, unfortunately, we just got to kind of trace it back. But the documentation, having that Medi screen print that says, look, it shows right here they have Blue Cross or Atlantic or whoever, I think that's your key, as you have those denials. Yeah.
I'm just going to add, it's interesting you said Blue Cross, because Blue Cross is the only one of the MCOs that actually has a different membership number. They do not use the ERIN number. They use an XOG number, and it's not on the Medi system. And sometimes people think they could put XOG in front of the ERIN number, and that's not how it works. So you can call Blue Cross with the client to get their XOG number on the chance your client doesn't have their card still. But it could be that your Blue Cross isn't recognizing the client because they're looking for that XOG membership number.
Well, there you go. That's a great tip.
Very good tip. Blue Cross always wants to do things a little different.
All right. Any other questions on eligibility or enrollment? All right. I'm going to turn things over to Lindsay.